Hi, and welcome to State of Mind. I say mind, but this podcast is as much about the body because the mind and body are one. And in this episode, let's examine the role of the mind in, in heart disease. Why is heart disease not just a physical illness? Why is it a mind body illness? What does the data tell us about the impact of psychological, emotional, and psychiatric factors on the heart? Firstly, why do we think of heart disease or indeed any other disease as being physical or isolated from the rest of the body? It's really strange. I mean, your heart is beating, but it's beating in your chest, which means that it is being bathed in the blood that is flowing throughout your entire body, and therefore hormones released from every part of your body is affecting the heart. Emotions affect the brain, are created in the brain, and they directly affect heart rate, blood pressure, the diameter of the arteries, and so on and so forth. And so clearly, the heart is not separate from the rest of the body, it's not separate from the brain, it's not separate from the mind. Now, very often doctors see heart attacks as purely physical, and this is unfortunate because the data tells us that unless you pay attention to psychological factors, you're not going to get adequate results in the treatment of heart disease. Firstly, anyone who's had a heart attack suffers not just the pain of what is happening physically, not just the physical outcomes of the illness. They also suffer psychological and emotional consequences. So, a person who goes through a heart attack frequently starts worrying about their own mortality. There's anxiety. Their mood is often depressed. They can have issues in terms of their sexuality, in terms of feeling intimate with their partner. They can have self-doubt and embarrassment about themselves. So all of this increases the risk for depression and anxiety. And in fact, any severe medical illness, and certainly heart attacks, increase significantly the risk for depression and anxiety. But it's also important to understand that the brain, the mind, and the mood is affecting the way the heart is functioning. And there is now absolutely unequivocal data that being depressed and suffering from a heart attack increases your risk of death by a factor of 2 compared to someone who has a heart attack without depression. In other words, if you have a heart attack and you're depressed, you're twice as likely to die from the heart attack compared with someone who had the same kind of heart attack, same level of heart attack, but no depression. Again, the reason is that when there's depression, it affects what we call the autonomic nervous system, which is the part of the nervous system that is not under conscious control and that modulates almost every activity in the body, including the heart, including what we call heart rate variability. So when you're healthy and there's no stress and you're relaxed, the heart rate actually varies from moment to moment. It's not steady. So for example, it'll go from 78 beats to 74 beats a minute to 82 beats per minute. And that's actually healthy. But depression reduces the variability in this so that the heart beats at a very constant pace. And actually that's not healthy because after a heart attack, that increases the risk for developing heart rhythm issues like what we call ventricular fibrillation, where there's the heart actually stops working because it starts beating abnormally. So that's one of the key effects of depression on the heart. But it also does other things that increase the risk of heart attack. For example, it increases the tendency of platelets to clump together. When there's a heart attack, it's because blood platelets, cholesterol deposits, etc., have clumped together and they create a clot, and that it's dislodged and that blocks the flow of blood into the heart. So the tendency of the blood to clot is actually worsened by anxiety and depression. Platelets clump more, and there's also something that we call inflammation in the body when people have depression and anxiety. Inflammation basically is when your tissues are inflamed, and characterized by redness, by warmth, by a feeling of pain when there's inflammation inside. But there can also be inflammation within the body, and there's a lot of research now, and where we find that almost all of these chronic diseases, what is common between them is inflammation. So inflammation is there in diabetes, it's there in heart disease, it's there in depression and anxiety and so on. So when there's inflammation, it increases the tendency of those plaques, that is the cholesterol deposits on the artery in your coronary arteries in the heart. It increases the tendency for those plaques to become softer and to rupture, that is break off, and that causes the heart attack. So depression, by affecting the blood, by affecting heart rhythm, by affecting the plaques, and by causing inflammation, really increase the risk of heart attacks and death after heart attacks. In particular, psychologists have also found that, by the way, it's not just mood. Psychologists have also found that personality can increase the risk of heart attack. And the kind of personality that increases the risk for heart attacks is something that is called the type D personality, which is a mixture of wanting to connect with people, okay, but feeling anxious or shy or inhibited about connecting with people. So if you want to connect with people, but you're not feeling comfortable, that creates the risk for heart attack. Also, something called cynical hostility. As the name implies, it's a combination of hostility and cynicism. Now, this is also a huge risk factor for heart attacks. If you're cynical about the world, which means, you feel like nobody's good, everybody's out to get me, everybody's untrustworthy, you always question the motives of other people, right? And combine that with hostility. You're actually angry with the world. You're actually upset with the world. That is very risky for your heart, for your brain, and for your arteries. It increases blood pressure, increases the risk of stroke, as well as heart attacks. So you see, what you think of as a physical condition, which is a heart problem, is not a physical condition. We cannot take the heart out of the individual without thinking of who is having the heart problem. The individual's relationships, how they feel, how they think, the thoughts in their mind, the love in their hearts or the absence of it, all of that determines how the physical heart is functioning. I think it's absolutely amazing and fascinating, that we are like this. But unfortunately, the medical system does not always pay attention to all of the aspects of our being. So if you have a heart problem, absolutely make sure that the psychological aspects are taken care of, that you're feeling good about yourself, that you're feeling relaxed, you're feeling happy, that there's no cynicism, there's no hostility. That will really improve your outcome, recovery, and healing of the heart, both emotional and physical. Thanks for tuning in to State of Mind. I'll be back soon with the next episode. Don't forget to like, subscribe, and comment.